woman giving birth should die. It's awful.
Awful.
A woman young in her pride should not lose her life to inadequate education of TBAs. It's sad to hear.
Absolutely not.
Even in the UK, chop beating.
Is this not why we do conflict training now?
You chop beating. In the UK, they train us how to defend
You do
yourself.
conflict training, where you do taekwondo and everything.
Why would you let a bloody man make decision for you that could end?
Is that not strong words?
I don't care.
If you see any celebrity telling you online to go use some medication to lose weight, hey, you are doing yourself more than they are doing you. Why would you want to drag your colleague through the mud and just like throw them into the sea full of sharks?
But do you believe these stereotypes? Nurses are rude, nurses are athletes, and nurses are unkind. I feel like Nollywood, they've got like a larger role to play in this situation.
Yeah.
Because why are you promoting something that is not right? We should try to consult and find out the right procedures and right policy to follow before you make a movie.
Many men think they are the Lord and the Savior of their wives. Many in Nigerian community.
Hi guys, welcome to the Vital Science Podcast.
Hi everyone.
I remain your co-host Taiwo.
And this is Oyinda.
Today we'll be talking about a very important issue.
Yeah.
About culture, power, and the weaknesses in the Nigerian healthcare system.
Yeah.
And as we all know, our Vital Science Podcast is say it as it is, and we don't mince words. And also we try to provide humor while we try to educate people. So yeah, how's your week been? What were you up to?
Well, do we have to talk about the week of Christmas?
Yeah, Christmas is coming.
It's been eventful. Such as at is well, eventful and then financially draining.
5 weeks, man. 5 weeks. You have to wait another 5 weeks
before you get another salary. But then, I mean, I've had like 3 group dinners, and which is really good.
3 group dinners. Ooh.
Or maybe 2 dinners and a lunch. And then we're tentatively sort of hang out with some friends, and then overall a productive week.
That sounds really lovely though.
I know.
I should get out more now. All right, should we get to this topic? I think it's one of, I don't want to say controversial or maybe juicy. Is it juicy? Is it the right one?
Well, it's tea.
Oof. So I think we should just delve into it. And
Absolutely.
Before we go on, I just want you to know it's not doctor versus nurses or doctor versus the whole healthcare profession, or we're just saying it's to like call out the wrong in the healthcare system.
This is
to
a gist
improve
between ourselves that we want to share with you.
You are invited. So today we'll be discussing a variety of trendy topics, and Oyinda and I will be exchanging different kind of trending topic or trending questions or gist all over the social media, Twitter, Instagram, and all. Then we felt like we should actually like come up here and talk to people about our opinions about this kind of things and see if we could educate ourselves, or if you've got a differing opinion, you could probably speak to us and respond to us in comment section.
So as Taiwo is educating you, I'm here to have fun today.
When the pre-production meeting, she was saying, it's about to be a good one. That's what she's been saying ever since we said we are going to shoot this episode. So we'll just get into it. I think I'll just take a trending question at a time. I'm not going to give you everything at once. So the first thing we'll be talking about, I know this has been on your mind for a while now, and you've always dropping hints in our previous podcast.
I am sad.
So it's about cesarean sections and why do women need the permission of their husband or the male figure head of the family to sign the consent form and before they carry out cesarean section.
To answer your question, we have to be realistic on this show, Taiwo. Many men think they are the Lord and the Savior of their wives. Many in Nigerian community. It is still sad that young people are like that. I mean, they still believe the same thing, that they are the Lord and Savior of the wife. Of course, you may be the head. I'm not disputing that. You could be the head of the family. Quite all right,
Is it a
fine.
cultural thing?
Absolutely, yes. We'll get to that. So you could be the head of your family, which is fine, absolutely right. But you are not the head, or you are not the owner of your wife's lives. But you would be surprised, like you said, that culturally, some men believe that once they like pay for the dowry, they are the owner of the part and parcel of the woman.
When you get married, people normally say two shall become one. So the two of you have become one.
They become one, but then that does not mean you hold my life while I own my husband's life. Anything that is pertaining to healthcare, he makes his choice unless he is not able to. That is the situation where I come in. Now, for women who are going into labor, why would you have? I'm so sorry, because I'm not. I have a husband, but nonetheless, why would you let a bloody man make decision for you that could end?
Is that not strong words?
I don't care.
I thought we are going through the calm tone today.
This is still calm. I'm laughing.
Oh, this is calm.
Absolutely calm.
I don't want to see your fairer part there.
Absolutely calm. I don't want anybody to quote me anywhere, though. So now, why would you allow any man to choose whether you should live or die? Sadly, another thing is that our culture is so patriarchal in the sense that your mother-in-law, I saw a story just this morning before on my way, that that in their own family, because she is the mother of the husband, and in their own family, in their family that she's talking about, the family she married into, that they don't do CS, and it is unheard of that the wife of her son is going to give birth through CS. Imagine that. I think our community, it is, and then it's the same thing happens. You would actually notice that even when you go to the hospital and you make female doctors that should understand better, many of them unconsciously, without thought or without a thought, they just turn to the man and say, oh, could you make decision for the wife? Oh, do you want to do this? Does your wife want it? And the wife is there. Our community, apart from being cultural, we are traditionally raised, or as community is most in a socialistic way that we put men ahead of everything in decision making. Well, I don't know if you know anything about feminism, or if this is something you agree to.
I'm a feminist.
Great. I mean, maybe on this show, maybe you have something positive. So now the thing is, the advent of feminism, actually erodes or improved this a lot in our society. Women in the past, they don't have a say. So I would believe that this thing where men make decision for the wives is rooted deeply, deeply, deeply into patriarchy.
Yeah, you've seen.
They think that a woman does not have the sense or the mental capacity to make the right decision when necessary. Why am I not? I hold my life. Why am I not able to make decision?
Do you think that's how they see it?
They don't. That is why I said that some men think once they own you, and they own your life. You're a secondary person, even to yourself. So
one thing I'd like to add is, why do hospitals ask, where's your husband during CS? Your husband needs to sign this. Because I've watched a lot of Nollywood movies.
And they still ask the same question.
I feel like
it is stupidity, honestly.
I feel like Nollywood, they've got like a larger role to play in this situation.
Yeah.
Because why are you promoting something that is not right? We should try to consult and find out the right procedures and right policy to follow before you make a movie. When a woman is pregnant and needs to have CS, you should promote this culture of, oh, you ask the woman, she's not unconscious, she's conscious, and very much know what she's doing. She has the mental capability to decide if she wants a CS or she does not want a CS. Why do you feel, except when she's unable to make her own decision? Why is it like at the jump of the gun, the beginning, or where's your husband? We need to discuss this.
Like I said, it is just our society. We are so unrealistically, and then it is natural.
Do you think it's an unconscious bias?
It is, of course, it is an unconscious bias, and that is because culturally our community is patriarchal. Honestly, we believe men are there.
Don't you believe so,
Taiwo? In situations of life, everybody owns their life.
As a woman, I own my life. As my man, he owns his life. When it comes to decision, I believe that everyone, individual people, should make their own decision. So the story Oyinda was sharing earlier on with us.
Even before I got married to him, he told me that it's a taboo. So that if I'm going to give birth, I'm giving birth through VG. My mother-in-law already told me it's a taboo to give birth through CS in their family. So I can't do otherwise. I really thank God that God came through for me, that finally my baby is here with me. I really thank God. No complications, everything went successfully. I labored for 3 good days, 3 fucking days.
She was telling me of a woman, she was pregnant.
Yeah.
Then the doctors says we need to do CS for the wife. And the mother-in-law, this is here to, I don't want to say mama's boy, but your wife is your wife. You didn't marry your mother, you married your wife. So she spoke to I don't know how the mother-in-law got involved in this whole, which is another talk for another day.
Don't you know that some mothers actually are the one germinating? And
Yeah, that's what I'm saying. Are the women supposed to be doing that to fellow women?
One thing I've noticed is that elderly women, they are the ones actually, they are the backbone of patriarchy in our society. Whereas they are the most deprived. In your youth, you were deprived. Then you got older, and then you was. So because I went through a lot, other women too must also go through that.
So it's a thing of strength.
It is not strength to me. It is not a thing of strength. It is a string of mystery works together. Mystery must have a company. It is just basically that.
All right. So then the mother-in-law got involved in the whole situation. The husband wants the wife to have the CS, but he couldn't speak up because it was a mama's boy. Then the wife called her own family, told the doctor, I actually like the wife. She took charge of her life.
Yeah.
Called her family and her brother and her mom, saying, there's a problem. I need to have CS. These people don't want me to have CS. The mother and the brother came to the hospital, signed everything that needed to be signed, paid for the hospital bills, and the woman that has CS, the child is fine, mother is fine.
Everybody's alive.
Yeah, then the husband, realizing the errors of his ways, came back, started begging the wife for the family. They took the wife home. She stayed in her friend's house for over 4 months.
Yeah.
Then the husband came every day just to show that he recognized the errors of his way.
Yeah.
And he proved himself to the family before they released the mother and child to him. Just imagine, I just want you to pause for a moment and imagine countless of lives that have been lost to this act of, I don't want to say is inhumane. Let me say that is
irresponsibility, honestly.
And how would you be saying, let me take it to this further step. I'm a Christian and I've heard this phrase used a lot of times. And I think we need to contextualize a lot of things before we say it. The Bible is based on context of what's happening or what was happening then.
Yeah.
There's this thing they say, the Hebrew women gave birth swift and fast, even before the midwife came.
Yeah.
If you read the story, what was the story that was happening then? The king, Pharaoh, he made a pronouncement that all male children should be killed in Egypt. These people, use the Nigerian word, God did their back. God was behind them. So everything they were doing then was easy, so that some of the children would be spared.
Yeah.
And the midwife were also sensible. They had experience on how to help with children and doing all that. So that's where it comes from. It's not like it's just Hebrew women. They just give birth without any complication all the time. No, it's just context.
And back then, if I may chip in, I do believe that there was no record of how many women really died from the complications of difficult delivery. And then one thing is, I am so sorry, because I do believe, well, I'm Muslim, and then the religion says that anything that any option that you can take to save your own life, because your life does not belong to you, belongs to God. That is the concept. Any act that you could take to treat yourself or to make yourself better or to, avoid death, you should take it. Cesarean section is that option if vaginal birth delivery is difficult. So why would I?
Can I ask you a question?
Yeah.
Do you see cesarean section or CS, as most of us know? Do you see it as a sign of weakness?
Absolutely not. And then one beautiful thing I actually saw now is that in the UK, so now in all the years that cesarean section has been done, this is the first year where cesarean section, many women deliver through cesarean section, and the deliveries are higher than per vaginal delivery. I was impressed. I was like, oh, really? Because then when I was in nursing school, I was like, oh, I wouldn't go delivery because I worked in a maternal and child hospital. My people, if you are there where people give birth, you wouldn't even want to carry pregnancy, talk less of giving birth.
Childbirth is a beautiful thing.
A beautiful way waiting. You wouldn't want to carry, but it's a blessing.
It's a beautiful thing. Seeing the little one come out is really beautiful.
To me, it was
but it's
terror.
painful.
It was terror to me. Seeing women give birth was terror to me.
People compare labor pain to breaking your bones over and over again.
So I was
Trust
like,
me,
I am
it's
pro babies. I want to have my own children. I was like, this is how difficult this thing is. Every time we like deliver people, I go back to cry, not because of the like cry of joy, the cry for the pain the women pass through. So and now the thing is, people go through cesarean section. It was lovely, no pain, but then the pain comes afterwards. The good thing is to have people who support you. So there is no delivery without the pros and the cons. And then all of them, so if vaginal delivery is as well difficult and sweet, and then the other one, CS, is as well difficult and sweet. So why do we rate one above the other?
But people do see CS as you being a failure because you delivering by CS.
So what would they call
you are
people
a weak
who have,
person.
So what would they call people who deliver by vagina and they had episiotomy? Episiotomy is when they cut the vagina to allow more room for the air to pass through.
Battle mark. That's a mark of war. That's what people consider. That's not my opinion.
So cesarean section with that longer scar is not a battle of war. That is even a bigger war than vaginal delivery.
Because
people are playing.
Because I feel people see it as a sign of weakness. Like I gave you example, the phrase people say Hebrew woman. You're not an Hebrew woman, you're a Nigerian woman. Why are you comparing yourself to Hebrew woman?
Do you even receive any trophy from being a warrior or a conqueror by delivering through vagina? Nobody has gotten a plague or Guinness World Record for that. Don't let anybody buy you.
Don't let anybody shame you for giving birth through CS. So now let me take you to the Nigerian Constitution. Under the National Health Act, it says a competent adult has the right to make a decision about their own body,
absolutely,
give informed consent for treatment.
Yeah.
There is no law that says a husband must consent for the wife, a woman cannot consent for herself. In emergency, healthcare providers are allowed to proceed to save lives. So what we are saying is culture overriding the law, and that is the delay that causes life. So that's the National Health Act and is under the Constitution. No culture, no religion,
no tradition, no senator, no minister, no president, no almighty individual should stop you from looking after yourself, signing any consent that would rescue your life. It's not just for the women, it's applicable to men too.
Yeah.
Because there are also men who are abused, who are marginalized, who are victims.
Yeah. And if there's any delay in CS, I'm just going to tell you some of the complications. So when healthcare workers, doctors, nurses come to explain to you that, oh, we need to have CS, it's not like it's always because you can't do it by yourself. It's most likely there's postpartum hemorrhage, there's risk for that might happen. Uterine rupture, your womb is going to come off and it's going to rupture, which is really horrible.
Why such a person, if there is a rupture, cannot give birth again? So we have to be factual. You need to know. So would you now risk yourself not giving birth again, or to go through something that will save your womb by yourself and the child?
And there's fetal hypoxia. I've been a witness to this, and this happened to someone close to me.
It happens to so many people that go through.
Delayed.
Many people go through the church to give birth. I have seen many cases recorded in that with the fetal hypoxia. Do you want to tell people hypoxia?
Hypoxia is when the child has lost, the child cannot breathe anymore. Oxygen, there's no oxygen provided to the brain.
Yeah.
The brain needs oxygen to keep the body working. If the brain lacks oxygen, then the whole body is dead. I'm sorry. So that's the situation, and this happened due to prolonged labor. Labor as you can see, the cervix. Most of you that don't know what cervix is. Cervix is just after the vagina.
Let's just say the opening between the womb and the vagina.
So it's like the neck of the womb. It's fully dilated, so the baby can come out. The leg of the baby was out, and the midwife will sit there 4 or 5 hours later, still trying to deliver the child rather than referring, which is also a suable offense. She broke trust by not referring at the right time.
This is what people should refer when they understand that this is beyond their competency.
Most people do agidi.
They do. Oh,
Stubbornness. Agidi stubbornness.
oh, they don't want. They feel like
they feel they are competent enough.
Maybe they feel it's shameful for
It's
them
an
to say,
ego
"I don't
thing.
know."
It's an ego thing.
Yeah. Why would you feel shameful for something that is beyond what you can do?
You've got years of experience, so your ego naturally kicks in.
Nobody knows it all.
Then you've got stillbirth. When you have fetal hypoxia, most likely stillbirth, then the mother will lose their life. I want you to remember, consent is there to protect life and not delay it. So the husband delaying the wife having CS is trying to off. He's trying to off his wife.
Even the husband, for doing that, it should be actually sued for misdemeanor or manslaughter, even if the wife dies in that situation. Maybe because our law is a little bit lenient to this kind of people.
It's not lenient, it's people don't know their rights.
Exactly, because this kind of husband can be sued for manslaughter.
Yeah. I just read out the National Health Act 2014 that is explicitly saying someone that is 18 and above, a eligible adult in Nigeria, which is 18 and above, can decide whatever they want to their body and whatever is they want to be done to them. They have the right to do that. So yeah, this next thing is BASBOS. All of you that you do BASBOS to your doctors and your nurses. Violence against healthcare workers. I've seen we shared this.
Best in Anthony Joshua.
You beat. I mean, I'm sure you probably see my video now where I was explaining when everybody in the hospital was literally running.
It's 1 in the morning and I could not sleep after hearing about the 2 doctors who were assaulted by patient relatives in Damaturu General Hospital, the same hospital that a female doctor was flogged by a patient a few months ago. One of the doctors who was attacked was an NYSC doctor, a medical officer, who was slapped and hit on the head by an arrogant patient relative who claimed to be a junior brother to one of the executive leaders of the hospital management board. This came after the doctor explained to the family that their patient, who was an urgent cesarean section case, could not be seen in the hospital due to unavoidable circumstances and opted to refer them to the state teaching hospital for proper care. It is becoming increasingly heartbreaking that the lives and dignity of those who sacrifice everything to take care of our lives cannot be protected. In the same Yobe state, the female doctor who was flogged by a patient could not receive proper justice. Rather, the case was settled on a 200,000 naira fine.
Let me give you another scenario. I was in emergency department visiting a sick colleague, and the next thing you heard is doctors and nurses. Boom! And there was a door that was open. I ran into that room. I didn't know what was happening. Ran into that room. That's when I heard, bah, 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 like they were speaking. I mean, I don't want to marginalize a tribe, but they were Hausas, and they are like the people. When I was training, they were notorious for that. When one of their tribesmen died in the hospital, that was in UCH. They were notorious for beating the person delivering the news and the people also surrounding the person delivering the news. So they beat the nurses and doctors upstairs. They came downstairs with the corpse of the person to the emergency department. I don't know what miracle emergency nurses and doctors would do. Then as soon as the emergency doctors and nurses, they are used to this. So they recognize it once they see it. So once they saw that, they just ran away. Without even attending to the dead body, they ran away because they knew what happened. After beating nurses and doctors upstairs, came downstairs to see beat doctors and nurses downstairs. How is this fair? How? It doesn't happen in the US where nurses get shot or doctors get shot.
Absolutely.
Even in the UK, chop beating.
Is this not why we do conflict training now?
You chop beating. In the UK, they train us how to defend
You do conflict training where you do taekwondo and everything. So the same thing with Nigeria. Nigerian nurses or doctors or other healthcare professionals running away is quite justified.
Is this fair?
They don't know what is fair. They're after their own emotions.
Beating somebody that is taking care of you and your family. Why do you think there's violence against?
A lot of us actually, we lack, just like you said in the emergency situation where the doctors and the nurses, they know when the red flags are coming in. Most of us actually, we lack that quality. We do not know. So, and then our communication prowess may be actually defaulted, in the sense that we are talking to a patient that you know is emotionally down or emotionally frustrated already. You are shouting back at them. If they give you a hot slap, I beg, receive it. You ask for it.
You don't know condone violence of any
We don't condone it, but nonetheless, your communication, you should know how to mitigate the situation with your choice of words or choice of communication. Somebody is coming in hot, you are also going in hot. Can you withstand the situation if they choose to remove their clothes? No, I mean, we are self-care professionals. We should be able to know the red flags and to know the choice of communication to use in that regard. Those are the two things I could think of now. If you have more, you could add.
Another thing I want to point out is violence does not have to be physical. It can be emotional. It can be verbal.
Which is what we nurses pass through the most.
Yes.
Emotional and verbal. Which is, I would say actually emotional and verbal violence personally are greater than physical. Because they are killing you slowly. Accumulated of that causes your cortisol to rise, depression.
Violence of any kind.
I read something today, honestly, and it makes me so very sad. A nurse said she's been in NICU, that is neonatal ICU. So babies between 0 to 28 days that are in ICU. So, and you know how, of course, they are just come to life. Parents are anxious, grandparents everywhere, families are anxious. The pressure is there. So that she's been working in NICU for 28 years, and then she just woke up one day and she thinks that she has given all herself to this job because she has repressed a lot that goes to a point that she has no meaning for her own life again. Well, may we not get to that situation before we actually take steps? If you are a nurse watching us from home or from wherever you are.
That's a sad thing to hear.
No.
All right, so long waiting times, when a patient has waited too long, that could lead to violence. Poor infrastructure, when there is no means of life-saving equipment. Like most times I say to people, there might not be a defibrillator in a teaching hospital.
We have personnel that was transferred to a hospital, and then
due to the strike?
Oh. So they could not. I shared it to you. So it's a long story, really. And then the genesis of that story, briefly, before Taiwo continues, is just that maybe somebody in the army has served this country, and then he sustained a gunshot injury. They rushed him to the hospital, somebody bleeding, then just Joesu strike. Joesu strike is joint healthcare strike that involved nurses and some allied professionals like pharmacists, medical lab scientists, and the likes. Doctors are not part of Joesu. So now, these people are on strike currently in Nigeria. They are still on strike, and because they are expressing their grievances, they want them to be met by the government. So now they got there was no one to attend to them. The doctors that are there, because I've seen some ignorant people. I wouldn't use the word doctor because they are actually very professional and then well-meaning doctors. This ignorant person says, well, nurses with the strike, how would they know their absence? What do they do on the ward anyways? I'll just do the vital signs for them and I'll give the medications. What else do they do? Okay.
Oh, apparently, maybe you should just do what you want.
Example of it is what we've seen. This person that they transferred to the hospital, there was no nurse to give to triage. There was no nurse to stabilize the wound. Because people will always believe that doctors are the first one that goes for emergency first. That person you see may be nurse. Because we worked in emergency, we see how these people work. We work hand in hand. There are more nurses than there are doctors. So how do you expect doctors to be everywhere? Does that even make sense?
That's a sad part. There was no blood. The blood bank was closed.
They could not titrate nothing. They could not do anything. There was no nurse to continue the observation for the patient. And the doctor said, I could do the vital signs.
No, not the doctor in this scenario.
In this scenario, the one I was talking about, I could, on social media, said, I could do vital signs. Vital signs is when you take blood pressure, heart rate, blah, blah, blah. For patients that are near death in this situation, you can even do it every 5 minutes, just to be sure that they are stable.
I think there are just few bad apples.
That is why I said I don't want to call the other person a doctor. I just want to say
that's a sad case to hear about the person that died.
Yeah. So they died. The end of the story.
Then there's shortage of staff. There's brain drain. When people get violent with the person that's supposed to be taking care of themselves, they will take their skills to where they are valid.
I learned that we only have 80 cardiothoracic surgery in Nigeria. And
maybe that's
one of them left as of this year, so they have 79 left.
Maybe this is why Oinda is over here in the United Kingdom. because our services are not valid in the motherland.
Absolutely, one of the reasons.
This impact, it leads to fear-based practice. Always scared for your life. Like I said, the emergency doctors and nurses, they recognize when there's about to be danger and they run for their
The
life.
danger signs, they know that.
Is that fair enough? Someone that is saving lives should be running to save their lives. That's sad to hear. No pun intended. Like Oina said, poor communication. When I want to tell you the truth, but I'm scared about you beating me, how would I tell you the truth? How would I tell you the truth about yourself when I do not want to get beaten up or get insulted in some cases?
And then healthcare professionals should be careful how to communicate, especially in tension situations.
I mean,
Then-
most times it's not really the healthcare professional. The healthcare professional might follow all the rules in the book, and even
But the
emotional
patient or the
intelligence.
relative will just be the one being unruly.
Yes, so these situations are weird. Like I said, staff Oina shared a story about someone with immense experience of 28 years in the neonatal unit, and said she's fed up with the person might still be young and vibrant, having a lot of things to offer, but she feels like
When you look at it, you'll be like, at 28 years, that person must be in their 60s or 70s. But come to think of it, if you finish nursing school at 2021, 28 years, you are still within your 40.
yeah,
You are still in your 40, and life begins
I'm
at
just
40.
about to begin. That's sad to hear. And people leave a profession, and in Oina case, leave the country. You cannot abuse people and see expect quality care. That's horrible. You can't. So
And this continuous over years and years of abuse against nurses is why they've become brutal in Nigeria. And if you're like, they are just horrible. They are this, they are that. They don't look after us. They are so
I'm going to.
You've been abusing these people from time immemorial. What do you expect?
Thank you. That leads us to the next segment.
Yeah.
Rudeness to nurses, respect to doctors. I want to start with this by talking to our colleagues in the medical profession. This is not against you. This is just talking about our patients.
Where you have chosen not to take it against them, I personally and confidently will take this against them.
Why do you say so?
When for the people who are not affected, they shouldn't take an offense. But for those sects that take to social media to always drag the nurses through the mud, you wouldn't see me in discussions like this. Even if I have to defend nurses, I wouldn't engage in it, because I know that in defending nurses, I have no choice than for me to drag the doctor. So I avoid it entirely. Why would you want to drag your colleague through the mud and just like throw them into the sea full of sharks?
But do you believe these stereotypes? Nurses are rude, nurses are athletes, and nurses are unkind.
Do you know what? To give you an example of that, we are athletes. As a student, I did a posting to Obatuashe Children Emergency Unit at UCH Ibadan. So I went there, and then children are always dying every day, basically. And this is not because they are not looked after. No, those nurses, I didn't know they would work that hard.
I've worked there and I can tell
Because
you.
you see children at the verge of death, they've been purging, like pooing, but defecating and vomiting for 5-7 days without nothing going in. Imagine you fasting dry and then you are still vomiting and purging
As
for
an adult.
5-7 days as an adult. Even 24 hours, all your body is gone for
Imagine
5-7
the
days,
child.
and the child is coming. Their life is almost gone. You can even see it on them. And then nurses and doctors running to set line to give medication.
Have you seen
to
these
see them.
graphics? These graphics of doctors and nurses
Maybe we should show it.
with a rope tied to the patient's soul, dragging the patient
From heaven.
Yes, dragging the patient back to the body.
So I will tell you, say being heartless. So the first time I saw that, I stayed back and I was watching all these people. It was like a film to me. Even myself, I was shocked. It was out of body experience to me. I was like, how could these people, like the response to that emergency? I was dumbfounded, honestly. But after that one shock, I became one of them. Who I also became a part of the team, running around and all
Do
that.
you think the problem?
But every time a child dies, Taiwo, every time we are like dry eye. I go behind the door and I cry every time. Honestly, God is my witness. Every time. I wanted to become a pediatrician before now, but from that period, you will never see me that kind of a situation any longer. Because then I come back outside and I'm like, hey, oh, Another emergency has come, you are
The
there.
switch of emotion.
It's a switch of emotion. There is no way for you to show emotion. How would you show? Even people would not. I do believe that if you show emotion, people would not trust in the service you would give. You are an emotional wreck, and then one thing is, it is actually diabolical because Nigerians believe that women are emotional, and the same strength you say nurses are heartless, and then the greater workforce of nurses are what? Women. So how could you say the same people who are emotionless or who are too emotional are still the same people who are heartless?
Do you think the public share your sentiment
They don't.
about nurses being heroes or just doctors? They should see them.
I actually have seen many people publicly actually advocating for nurses heroism. So as there were people who don't believe, who thinks we are incompetent and we are athletes, there are people who actually think that.
Have you not seen doctors behaving the same heartless manner and rude manner as nurses?
Of course.
Why do doctors get spared of this kind of behavior?
Again,
and
because
nurses don't.
Again, it comes to the fact that doctors can do no wrong. And then this genesis of a thing, it comes, actually this is a long-standing thing. Many people believe that doctors, because of the years of the number of years they go in for training, they believe that if you are in school for 6-7 years, you have better training, you have better education.
How many years do nurses spend in school?
So to tell people, for people who went through nursing school, I went to nursing school for my training, rigorous training. We only have two weeks of holiday. The 3 years, it is for you to go through practical and theories. So if my syllabus can be completed within that 3 years work frame, and I still have to go to a university if I choose to, or a postgraduate specialist school like a perioperative, anesthetic, or midwifery, for me to complete another 18 years or 2 years to make it fine. So if I undergo 5 years of training, how would you, and my syllabus is completed, so how would you rate me as being intellectually lesser than a doctor? Our trainings are different, our professions are different. You don't expect us to go through the same kind of training. It is actually barbaric and archaic.
The nurses are always enforcing. The nurses are like the enforcing of the hospital policy.
Yeah.
They enforce the visiting hours, they enforce a lot of
So
things.
people from, by virtue of
And
that, they
people
hate
think
us.
they are heartless and unkind.
They hate us.
Meanwhile, they are unaware the hospital has policies and such.
Absolutely.
While the doctors are seen as authority figures and final decision makers.
Yeah.
Do you think
Yeah.
same message for different professions and different response to different professions?
Yeah, you would, and just like I said to your words that you were reading, I believe strongly that over familiarity also leads to disrespect. In the sense that nurses are the ones, we make jokes with patients, you show the emotional side to patient. The patients see you. They see you at your worst, even when you are freaking out on the ward, when you are at your worst, when you are at your low, patients see you. And then again, we must actually also talk about seniority in nursing. They see the way some seniors behave towards junior nurses as well. They also see that we could disrespect ourselves, and then so by virtue of that, they could disrespect us.
That's sad to hear. I just wanted to know that nurses are the safety net of patients. They recognize early deterioration. They continually advocate for patients, and they monitor patients continually. Your first contact in the hospital, apart from the receptionist staff. So I want to let you know, disrespecting nurses is you silencing nurses and losing the larger part of the workforce. Like Oyinda here, being in the UK and not in Nigeria.
You use yourself as an example. Nurses, we have potential, but where we are not allowed for our wings to fly, we cripple them ourselves. We do not even allow another person to do it for us. We are like victims that have been abused over and over and over again. What do we do? And the nurses would have refused to let their wings be clipped. Those are the bagged ones. They are facing principalities and powers from the top bosses, above, across, and below.
So you think it's an intra-professional?
Inter and intra. Both of them.
All right. That's perfectly set me up for the next topic, which is consultancy in nursing, pharmacy, and lab scientists, and pushback from the medical profession. There was a memo or a discussion in the forum whereby consultancy in nursing, in pharmacy, and pharmacy,
Nurse
lab
and pharmacy.
sciences.
Yeah.
And lab science was supposed to MLS for people that know. Were meant to take in place, and we saw a memo from our medical professional colleagues whereby they were pushing back, citing some examples, which I found ridiculous and ludicrous. As learned people and having their ego, I think it's an ego thing. I know it might not be majority, but the leadership or those people that send the memo, you should be ashamed of yourself. You should look at yourself in the mirror.
They are the representing body for this profession. I mean, their voice is for the majority. To me, it's the majority.
You believe the majority of the medical profession
majority vote
doesn't want consultancy in other professions.
Even the people who have kept silent. Silence is agreement to me.
Is consultancy tied to just meant for the medical profession?
I don't know. They said, according to their memo, that there was going to be conflict of interest, and then in the quality of care provided.
How does that impact quality of healthcare rendered to the patient?
They are actually being ridiculous. Imagine all these people that we turn over when we don't have enough doctors in the country. If we have advanced specialist nurses who could do the work of doctors, or say for example, resident doctors could do some other things while these advanced or specialist nurses work in place of these resident doctors, and where they need opinion from the doctors, they seek it, but not that these doctors should be the primary person. They are not pushing you away from your job. They are either aiding the community of Nigerian people to receive health care. Because now you go to the hospitals like, oh, we don't have bed space. We are pushed away, we are referred, we are pushed forward, we are sent away. You wouldn't be sent away if they have enough professionals.
Do you think they misunderstand the healthcare as a one profession monarchy rather than a multidisciplinary team working together for a common goal?
This is not a mistake on the medical professionals' part. This is something they believe in. And they believe that.
That's what I'm saying. Do they believe it's a one profession monarchy?
From repeated actions from that group, I think yes, they do.
And is it due to...
No offense to my doctor friends, but yes, you do.
Do you think they believe is due to fear of loss of dominance, or
absolutely yes,
loss of
relevance,
of about insecurity about their profession?
Absolutely yes.
Do they think they can continue to subjugate other professions?
Stop putting me on
I'm not putting you on this. I'm just stating the facts.
all these answers
based on my research.
Yeah.
I just want to look at you, look at yourself in the mirror. These things, these consultancy roles and specialist roles,
yeah,
they have been implemented worldwide and got positive feedback and positive reviews. And it's
and they are even training more nurses in this regard.
It's a shame that people with little ego behaving this way. Why are you concerning yourself with what's happening in another profession?
And this is why the healthcare system in Nigeria is crippled, because we don't have the enough professional, the enough workforce and brain behind it. We were talking about research in Nigeria today. Yes. Research in Nigeria is as crippled as it is today because some professionals are the only one that want to be there. They don't want another person to be there.
That reminds me.
They are the only ones that want to be there.
That reminds me.
Yeah.
To the National Health Regulatory Ethics Committee and to the National Agency for Food and Drug Administration, yeah, I'm putting this to you. I've submitted a lot of proposal. And my name is Taiwo Gutoyimbo. I've submitted a lot of proposal to you about how to reform the research framework in Nigeria to be more effective and creating more opportunities for Nigerians and the wider people, for Nigerians basically, how to ensure they are provided the opportunity of clinical trials whereby novel drugs are developed. And this also helps the country to start coming up with their own development of drugs that we could export to other countries. Clinical trials is a over $500 billion economy.
To our doctors colleagues who are undergoing research, getting grants and funds from Western countries, it doesn't have to come from them. We can also conduct research and
nurses conduct research in the UK everywhere.
I don't want to talk about it. It's just so barbaric. They get grants for research, and you don't see nurses being involved in the research that they conduct. So well, the viability of that research, actually I query it. Most of the data that come from our side, I query them.
Oyinda is saying
because many data are falsified.
Some
when
of the data are falsified allegedly. We do not want to get sued. Allegedly.
When we do not follow the right channel, why would falsification not happen?
My own concern and my food for thought, or the food for thought for the administration, is that please get back to me. And also, if anybody is interested, I'm about to start a research to get knowledge of the healthcare workers in Nigeria, their understanding of clinical trials, not necessarily writing an article, understanding what clinical trials is, medicinal investigations of medicinal products. When you do clinical trials, okay, you could reach out via the comment section and I will message you. So what I want to talk about is one of the benefits of consultancy and specialist role in other professions. This is for patient safety. For those of you that don't know, I work in oncology and hematology clinical trials, whereby, which is just cancer and blood disorders trials, where we work with different teams. I work with doctors, dietitians, nurses, different people. And when we want to have a meeting, we have something called the MDT. Everybody's opinion is welcome. There is no monarchy. There is no one team monarchy, whereby a doctor is the head of the hospital, a doctor is the head of the medical advisory committee, a doctor is in charge of the ethics board, a doctor is in charge of food, a doctor is in charge of water, transport and all. That's ridiculous.
Even when you tell these people here, like, could you help me do it? They tell you, because it is not my job, which is right. I even appreciate it more. I think we should all learn to inculcate into our brains as Nigerians that we have a role and our roles are limited. We should not, it's this, because there is no difference, or there is no solidly defined role. I think medical professionals, they've encroached into nursing profession so much.
They do rewrite it.
Imagine they are the ones in laws.
Imagine
they are the ones in
University
laws.
College Hospital, while I was training, by the way, so you know,
they could give IV before. Now I don't think they could.
A nurse can't give antibiotics, IV antibiotics. Is that not ridiculous?
When I got into school, yeah, I mean during the first few years, they were doing that. Before we left, few years apart, they stopped.
Is that not sad? We are not knocking anybody. We are just asking the one professional monarchy in the healthcare system in Nigeria. Take a look at the mirror. Take a look at the mirror.
We see house officers on social media complaining that they are burnout, they are overstretched. They wouldn't be overstretched if other people's jobs were not hijacked from them to be given to this young house officer.
I feel sad for them. I feel sad for them.
Very unfair.
And like they used to say, I think this situation arises from what the people in charge has passed through. They want to pass the trauma.
Mystery lost company again.
To the medical officers. That's sad. It's just sad. So let's just move on. Don't let us dwell on it. There's another topic you have strong input in. Today is just about the topics you have strong input in.
I wasn't the one who composed this entirely, people.
So Oyinda has got strong input. She was talking about a celebrity that was promoting weight loss medication a while back, and she was saying this person, she was telling me, so this is why I curated all these topics for her. I've gone through it with her and she was happy. So she's got something to say about that, about a celebrity advertising a weight loss medication, saying, why is this person not talking about the side effects in the advertisement? And most of these weight loss, people just take them without consultation with a medical health practitioner. They take it as they see it on Google or YouTube or any ad place.
Even some people go for prescription, but they don't bother to terminate the prescription. Or, I mean, the prescription just keeps on rolling and rolling without, because system can be broken anywhere, even in developed worlds. You go to a GP or a personal doctor to prescribe this kind of medication to you, they gave it to you. You are supposed to use it within a time frame, but there is no review, and you keep on using it, causing a damage to one or two organs.
Is there no a limit to the drugs you give to a person per prescription?
There should be a limit, but you've seen that so many patients that I've seen in situations that they would have been on aspirin. Maybe they only needed it for a year or two, but they've been on aspirin for 5 years because nobody reviewed and they thought exactly. But there was no proper communication with them or informed consent again that this is also a number of years where you were supposed to have been on this for. They just keep on rolling and rolling the prescription through local pharmacy.
But I believe might not necessarily be Nigeria. I think Nigeria healthcare system is porous, whereby you could just walk
go to the chemist and buy it again.
and buy a drug.
Exactly.
I feel like we should. I'm just going to run through some side effects before you go deep into people that are self-prescribing themselves.
Yeah.
Or buying from unregulated sellers.
And then if you see any celebrity telling you online to go use some medication to lose weight, hey, you are doing yourself more than they are doing you.
I pity you. I pity you, my brother. I pity you.
My sisters.
Let me tell you the side effects. When I say severe, obunge, nausea and vomiting, you want to vomit your guts out. That's it. Nausea, you'll be feeling sick all the time, like you want to throw up. You go to feel like, say, your stomach is torn. Another one is dehydration, severe dehydration, where you feel like all your part of your body is dry. Everywhere is just dry. I'm not talking about wherever you're thinking about. I'm talking about like dry mouth, dry
here. Even your body internally will
like you
hot.
feel like you want water, you're craving for water. There's electrolyte imbalance. When you are dehydrated or when you are vomiting, throwing up all the time, your body is losing vital electrolytes, and the electrolytes that is losing, like example, when they ask you to go and do some blood tests in the hospital, like sodium, potassium, chloride, all these blood tests you see, they're electrolytes in your body that you might not know what they are doing, but they are very important for muscles and function.
They are like batteries in our body. They allow conductions to happen.
Yes.
One, if they are too low, it is just like when your battery is low, what happens? Your touch light is like this, dim. And then when the battery is completely run out, what happens? The battery is dead. So that is exactly the same way the body would collapse and just shut down.
Yeah. You know, one thing that is very important, I've seen cases, mind you, we've talked about this, a lot of cases on the rise. Started seeing young people and even older people taking weight loss drugs, coming into the hospital. Like I said, I work in cancer care. You started seeing people on these drugs coming down with acute pancreatitis. And when you talk about acute pancreatitis, is when your pancreas, the thing in your body that makes insulin. Insulin is meant to regulate the sugar. There are some people we've talked about this in our podcast episode titled diabetes.
When nothing is wrong with their insulin and they are giving themselves to curb their work of the insulin, what happened? Excessively producing.
So the body can't detect it anymore. So there's no sufficient. You need to like start injecting yourself with insulin. Your sugar can't be really regulated by your body anymore. So you need more insulin to regulate it.
And that is if conditions like liver problem have not started.
Yes.
Actually, I've seen cases where people are paying for endoscopy. They just can't explain the bloating, the hematuria, the blood in pool from the back. They just couldn't explain it. Endoscopy shows nothing in the gut. Of course, I've seen case of somebody on one weight loss medication. So, and then the doctor asked the person to stay off it for 6 weeks. They noticed a difference, but still there, which means it has caused a permanent damage somewhere. So they needed to start investigation on that.
Another thing I want people to know, it can give you cancer.
Absolutely.
Like I was saying, acute pancreatitis, that's inflammation of the pancreas.
Which can lead to, when it becomes malignant, when it becomes chronic, it becomes cancer.
It can give you cancer. I've seen cases of cancer of brain, cancer of different things.
And then some companies that produce this kind of injection currently in the US, we don't want to mention
they are
them,
under
but it is not allegedly. It is on the news, online,
they
everywhere. They are under investigation. And some of them are in lawsuit against large number of people.
There's gallbladder. She was mentioning liver. The liver and the gallbladder, they are connected. You could have gallbladder disease or liver disease. Another thing people don't talk about is the mental health issues attached to taking these drugs.
Because insulin is like an hormone also. And then it's just like when you're a pregnant woman, when you give birth. Many women have, maybe they can relate, they would say that their hormone just crashed down and they can feel the crash down in their
insulin,
body.
like weight loss
So now let's lighten this to insulin. Insulin is not produced. What happens? The body feels it. And then when the body feels it, there's like rejection, where this should have worked. Your glucose are not binding to anything. Your brain is not functioning. from there. And glucose is needed not just for you to function or for you to think or for your brain to work properly. Glucose is needed in many producing organ for hormone. The gonadotropins, every one of them, they need glucose, not the glucose sugar that we eat, glucose itself that has been converted to work. If this is not there, of course, there's hormone imbalance.
So my suggestion for you is put in the work, go to the gym. There are people having surgery. Surgery also has a side effect, but there are safer ways to have weight loss medication. If you are on weight loss medication, get regular checkup in the hospital. Weight loss should never cost you your life.
Absolutely.
So let's talk about, there's a topic that's very dear to me.
Which one is it?
Is maternal and neonatal deaths due to TBAs input on this. When I say TBA, or when I'm speaking too much grammar about maternal means mother and child death due to there's an image that's going to come up now. I can see the image whereby, look at this stretch, the scarring. In Yoruba we say ila. Look at the scarring on the woman's abdomen. Just look at the scarring. It was the image you shared with me, the scarring, like on one corner of the stomach. Why is that needed during childbirth? That's my first question. How does that affect what's going on in the body that you're scarring somebody? And most of this thing is because these TBAs, rather than
TBAs are traditional birth attendants.
Yeah, baby, mama baby, baba baby. See that they are always in the communities. I don't know what they call it in Igbo or something, but they are just these older women that have got experience in childbirth.
Just from taking deliveries, not because they undergo any training or
any. Some of these TBAs were actually, if you remember, I don't know, when I was in nursing school, we're told that some of these TBAs were actually trained
because of the atrocities they caused.
No, but
the cause atrocities. That was what led to
the training, and because of the shortage of staff of healthcare workers, doctors and nurses in the community, the TBAs, the trained birth attendants, were trained on how to give simple emphasis on simple delivery, not complicated delivery.
Anything that they think is beyond them,
they refer. Most of the important is because of the atrocities they've committed. So they train them how to do simple delivery safely and recognize the signs of complicated delivery and refer timely. So,
but they are now taking more than they can chew.
Why do you think?
And they've become emboldened.
Why do you think? And the statistics really show Nigeria. I can't remember the major stats off the top of my head now. I'm sure it's in the high 50s or 60s, like in the world. The maternal and child, if I'm not wrong, maybe 50s or 40s. About maternal and child deaths in Nigeria is really high. Nigeria is not a country that is not. I mean, we are developing or underdeveloped, but we are not a country that we are so backward that we cannot implement safe delivery for mothers and children. And why do you think people still go to all these TBAs? Because it's sad. A woman young in her prime and the child no seeing nothing coming into this world and their life cut short.
I think our problem is that we do not review our laws or the reforms that we've had. Because early 2002, during a presidential era, was when this thing came about. And this came about because they found out that in the community, like you rightly said, there was a shortage of midwives. That was how they thought of the traditional birth attendants vocational trainings, because this is what these communities were used to. How do we entrust them and their healthcare to some people or professionals that they already trust? And then it was why that presidential ministry thought of that, and which actually worked. As of then, now we've evolved. A government, as of 2015, I believe, should have reviewed this thing. They should have actually monitored the effectiveness of this law that was enacted years back, like a decade after. There should have been a review, but because there was no review, we are still existing on a past law from 20, 25, 30 years ago. There's no review. Our law should actually mimic or mirror where our development is. And this is why we are still being described as some part of the world as being underdeveloped, because our laws are not reviewed.
So I've got some research facts here. Why people choose TBAs, why they go to all these traditional birth attendants. First one, cheapest care.
Yeah.
Which is ridiculous. I feel like childbirth should be free
Very
all
good.
over the world.
Absolutely.
It's free. If you've seen how labor is, antenatal care, postnatal care, everything should be free. It's not easy. Like, I've seen labor, I've seen throughout different trimesters in
Well,
pregnancy.
if Nigeria government is afraid of overpopulation by making delivery free, my brother, they could cap childbirth. That's a form of control.
There's no
Make delivery
population
free.
in Nigeria.
Some people believe so.
Where?
Make delivery free,
I like to see the facts.
and then cap delivery for everyone. Because as it is, you are making it's even so financially draining, and then
The government is rich enough.
to shoulder this.
We are one of the richest country. We are the richest country in Africa. Our cultural trust, like you said, people trust these people. They've
Yeah.
always gone to them. They know them. They
Yeah.
live in their community.
Yeah.
Why not just go to people you know? There's fears of hospital whereby people complain about the rudeness of the workers,
And then-
the heartlessness
yeah.
and unkindness
And
of
then
workers.
some people believe that hospital is for people who are near death.
Yes, you've heard a lot of that. Like, if you're about to give up, that's when you go to the hospital. There's fear of surgery. They think hospitals are dishing out CS right, left, right, and center without informed consent, which is crazy to hear. I've never seen a hospital they are saying free CS. Pick your CS.
In all
Free
honesty,
CS.
they said some private hospitals that the better way to generate revenue is for
Is
them
to
to
do
just
CS.
do CS.
Mm.
Yeah, we have seen discussions around
So
that.
their fear is valid.
Yeah.
I think the government needs to investigate about the legalities
Yeah.
and illegalities of such institutions.
Absolutely.
There's supposed to be a regulatory committee. I'm sure there is, but I think because of corruption has eroded some of their authority.
Absolutely. Yeah.
So let's move on. There is a fear of mistreatment. There are some people like you rightly said, quackery. They've got quacks in the hospital. You mistreat someone that doesn't need a drug, you give them the drug.
Whereas they have somebody in their local community that they trust, would they come to me or rather just stay where they trust?
Exactly. And these are some limits to TBAs roles. They cannot manage obstructed labor. They cannot perform CS. Like I said, if you see the scars of the graphic we show, I'm so sorry, it's so graphical and very, very primal. They can't provide blood transfusion. They can't resuscitate critically ill newborns. If a child is hypoxic, what do? They will beat the child. Instead of resuscitating the patient, they'll beat the child until they cry. And meanwhile, fluid is full in the child's lung.
Yeah.
So the way forward, we're not talking about banning TBAs.
Yeah.
I think TBAs are very important in the community.
But then again, there should be a reform and a revisit of the laws.
Exactly.
For these people, for them to be, just like they were previously monitored, they need to be monitored again.
Yeah. And they need to be, like you said, they need to be retrained. My take home from these TBA issues is that many women, I've got this quote written down here, many women choose traditional birth attendants because they are cheaper and familiar. But TBAs can't handle emergencies. That's why the training comes in place and reform, whereby there's education on recognizing complications early enough and referring timely to not prove the life of the mother and child in at risk. And also, when complications happen, referrals are often too late from TBAs.
Absolutely.
The child is about to die, the mother has got rupture of the uterine walls, of the uterine ruptures. There's different kind of ungodly things that was already occurred before they, like the graphic I showed you. Look at the woman's stomach. You can't tell me there might not be an infection that's already gone into the body that's building up, and you don't know how long they've been at the TBA's house. Maybe they've spent 2 days, 3 days sometimes laboring. You shouldn't labor for 3 days.
Yeah.
And we are not saying you should ban TBAs. It's about knowing that hospital saves life, and no woman giving birth should die. It's awful.
Awful.
A woman young in her pride should not lose her life to inadequate education of TBAs. It's sad to hear.
Absolutely not.
I'm getting passionate and worked up about this situation. I've seen a lot of young women cut short at their pride.
Everybody should be actually everybody should feel the same way.
The nation is losing its people.
Yeah, absolutely.
The nation is losing our children. Imagine if it was somebody's son that died, would it not be investigated? I'm calling on the Minister of Health, the Women's Rights Minister, and also I'm calling on all lawmakers institute this law. Talk about this law on the floor of the Senate. It's not every time you talk about the president's wife's dinner. You don't talk about your allocations all the time. You talk about things that happen to people, everyday people. Talk about quackery for once. Quackeries cause a lot of people's lives.
They should think of humans for once. They should think of humans for once and not the resources. I think the world is now driven towards resources than the humans. Is that the end of?
I've got a little closing remark.
Okay.
If you indulge me.
Absolutely, yes.
So
I mean, it's been a wonderful discussion and gist part.
I've got a little thing I've written here, so if you permit me to read it out to you. Everything we've said today, the Nigerian healthcare system is not failing because people don't care.
Yeah.
And it's struggling because the culture overrides the law. Ego overrides teamwork. Fear overrides evidence. Real change starts when we respect patients' autonomy. I'm talking to you, Nollywood people. I'm talking to you. You guys need to do better.
I don't want to imagine the atrocities these people actually age.
This is talking to Nollywood. I'm talking to you. You are the first contact of where people hear and see stuff that they do. You shape their mind from young age. There are a lot of things I've seen in Nollywood that shaped my mind in a certain way about the nursing profession. Until I became a nurse myself or a nursing student.
It is a form of radicalization, what they do.
Yes, so Nollywood, do better. I'm beseeching you, do better. And also, respect will protect healthcare workers. You see in a lot of, I'm not putting it on only Nollywood, I'm putting it on everybody. You see where nurses are getting verbally abused, step in, talk about it. Or doctors getting abused verbally or physically, get in. Say this is wrong, we shouldn't do this. They have the right to deny you health care if you do that to them. And you're putting your life at risk or your loved ones. Educate the communities. This is where we are talking about community mobilization and education. Where are you spending all the allocated funds for community mobilization?
There is this influencer, I think, a Akuku doctor, that was going from one healthcare center to
another. You see,
because the federal government has said they allocated money to healthcare, the local government, for them to fund the healthcare centers. And then we, the people, should be the one to call them.
Why is the federal minister of health putting people in charge?
I don't think any state has even used the money for this purpose.
Where is the accountability to your office, Mr. Minister of Health, asking the public to police the people under you? You should police them yourself. And putting out a letter is a disgrace, I must tell you. It's just like here, the Secretary of Social Care and Health Care saying, oh, we've allocated money to the NHS. Go to your NHS office and speak to them. Speak to the head of the CEO of the trust.
Why must we be the ones to do that? You allocated the money. You should trace your money.
These are the things that causes the loss and the mistrust.
Know how your money is spent.
It's sad to hear. And I must plead with you. If you're unable to do it, you could create committees that are in charge of making sure they're like watchdogs, making sure this money is spent for what they are earmarked for. It's not an attack on your person, but it's an attack on you losing your responsibilities. So, I'm sorry, I'm almost done. We should choose collaborations over control. I'm talking about the one profession monarchy. It is a multidisciplinary team for a reason.
Oligarchy.
You guys are not the only ones that is meant to be in charge of the healthcare. You can't be in charge of nurses.
This is not an oligarchy practice. You are not kingship.
Yeah, you can't be in charge of nurses. You can't be in charge of pharmacists. They are a profession on their own and must have their own heads.
Because of this monarchy of the thing in healthcare, this is why things are just haphazardly run. Yeah, there was a video that I showed you or that I talked to you about.
And I was shocked to discover that only 22% of Nigerian hospitals had clean running water and soap.
Wow.
And of those, only 12% had the clean running water and soap in the delivery room.
You know who said it?
Yeah.
Was Mrs. Saraki, the former president, the former Senate president, and the former first lady
his wife,
state government.
Yeah.
Is that not sad to hear 22% of the whole of Nigeria?
Your president was in power. He was the number 3 individual in Nigeria, and then you are coming to tell us this after he left office. Why were you not advocating for that?
The sad part of all this?
Yeah.
You see the video of our doctor going to a PAT, Premier Health Care Center. They only have a handful of forceps, whereby you sterilize the forceps, and like I said,
they are even rusted now.
There are some forceps that are rusty, and they are not getting their money. What are you doing with our money, Mr. President? This is a call on the president. We voted for him, Mr. Governor. What are you doing with all the allocation?
Thank you. We've called and called enough. We are at the verge of running out.
It is sad. Is it when
running out of hope?
Is it when the healthcare system fails completely? That's when they organize state of emergency. I believe a state of emergency in the healthcare system of the Federal Republic of Nigeria should be called.
Absolutely.
It's just sad. Thank you very much. This podcast will beg you, I want to beg you.
Please share to everyone you know.
I want to beg you, make a talk. Niger to Niger or anybody to anybody.
Yeah.
Let's talk. Not even only Nigerians. This podcast is not only for Nigerians. It's for the whole of Africans.
Yeah.
Or the whole of everybody living in the world, wherever you are hearing us from.
That they believe strongly that healthcare everywhere is man-aligned, and there's something wrong with the healthcare system.
Someone asked me a question. Is healthcare a privilege or a right? Then I looked at the question and I was like, why is this person asking? Healthcare should be your right. It's not a privilege. I'm not privileged to receive healthcare. It's my right as a citizen. You are right to protect my life. Mr. President, when you did your swearing in, you made an oath
that you're going to keep everyone safe.
Yes.
You're going to give everyone basic amenities. And then the Abraham Maslow's law of hierarchy, the basic needs we all need. Number 1, air, which we receive from God, blessing. If our government or our presidency, if they were the ones supplying oxygen, many of us would be dead.
People would have died.
Water. God gave us water, but we humans, we've contaminated them. The only work the presidency or the government, the only work they need to do is just for them to purify this water for us.
The healthcare of Nigeria system,
they failed woefully.
You know, the sad part, Nigerian healthcare system is one of the best in the world. If the standard dies, I mean, till now I'm not talking about the amenities or the equipment. Yeah. I'm talking about the professionals. We are seasoned.
Because everywhere we go,
we can stand toe to toe to anybody in the world.
We have what it takes to make Nigeria great. We are just not given the resources. We Nigerians are epitome of excellence. And I'm going to put it to our leaders, make a change now. Change begins with you and me and I. So thank you very much. Again, do not forget to share this episode. We feel like we are ending on a very high note, but this is where we should hold so that everyone could feel our emotions. Please share to everyone you know. Comment your wherever you've experienced. They should also share their grievances. Share with us. We want to hear from you. So thank you again for a beautiful show. Subscribe, like, follow, and comment. And turn on notifications. Do not forget that your health is your wealth. Stay empowered and stay informed. Thank you. And we'll see you on another podcast. Merry Christmas and Happy New Year. Merry Christmas.